Hello friends, it's pleasure to have you back on the channel of Clinical Care Insight. Today I'm going to start the series of lecture of pathology. Okay, so here is the first chapter and the name of the chapter is Introduction to the Pathology. Okay, basically in these chapters, okay, I'm going to introduce you about the subject pathology, okay, what things it's cover, okay, what are their branches, fine, what are their landmark discoveries, how histories is going on, okay, it's improved, fine. Apart from it, we are going to also discuss about some of the key terms, okay, which is used in the pathology, fine. So here is today's our lecture outline. First we will discuss about the introduction, then we will emphasize on the key terms, fine, because if the certain terminologies will clear in your mind, okay, then you can easily understand this chapter, fine, this subject itself, okay. Then we will discuss about what is mean by a disease, okay, and we will discuss about some of the principles, fine, and the major classification of disease, that is called as the type of disease, okay. Then we are going to also discuss about that, okay, fine, disease is something which is you can say which is deviation of the normal body functions, fine. Then what things causes, okay, what things causes this disease. So basically we are going to discuss about the cause of disease, okay. Then we will discuss also about the history, fine, because if you pay your attention, then you come to know that one of the things which makes human to adapt the, you can say, the planet, adapt the environment, adapt this you can say the earth, fine, is just because human sapiens, or we also call as the humans, okay, they are master in the art of respecting, you can say, the culture, the tradition, okay, also having the set of idea about the history, okay, and always eager to discover something new, okay. So we are also the future oriented, we respect our tradition, okay, and we have the knowledge about our history. That's why we are the one of the organism, okay, which are living in this earth successfully, fine. Got it? So that's why the history is important. Then we will discuss about the branches of pathology, that what are the branches, okay. Then we will discuss about some of the methods in the pathology. So let's start with the introduction. So you might know that the word pathology comes from a Greek word, okay. Greek word, the pathology word is derived from the Greek word, and that is called as the pathologia. That is called as the, very good, it's called as the pathologia. Most of the, you can say, the medical terminologies are derived from the Greek words, fine. This pathologia means, in the English language, it means the study of sufferings, okay. Study of suffering, fine. But in the modern terminology, the pathology, okay, the word pathology is defined as the study of diseases, okay. The word pathology is defined as the study of diseases, study of diseases. Got it? Now, how you will study the disease? Okay, the first things you have to understand that for understanding the disease, you have to understand their cause, okay, and this cause is called as the etiology, fine. The cause is called as the etiology, okay. Once you will find the etiology, you find basically the cause, then you know that any disease, okay, disease develop, fine, with the two main, you can say, the changes. The one is called as the mechanical changes, okay, mechanical changes in the cell or in the organ or a tissue, fine, and the another changes is a chemical changes. Okay, chemical changes means whenever any disease develops in anyone, okay, taking the example of the humans, then there is a two things which is, you can say, changing. The first one is called their mechanical property is changing, and apart from that their chemical property is changing. And these, you can say, the transition, this changing is in a stepwise manner, in a very stepwise manner. So this stepwise manner of, you can say, the cell chemical constituents changes or cell mechanical, their shape and size is changes. Okay, this is called as the pathogenesis. This is called as the pathogenesis. So the in the cell, whenever any cell, okay, is injured, okay, is injured, then the two things happen. One is called as the mechanical changes, another one is called as the chemical changes, and these changes happen in a stepwise manner. Fine, it's happened in a stepwise fashion. Now this stepwise fashion is in the pathology, this stepwise changes fashion is termed as a pathogenesis. Okay, we are discussing the key terms. Pathogenesis. Now there is one another similar term called as the pathogenicity. Okay, pathogenicity is basically a property. Okay, pathogenicity. So pathogenicity is the property of a causative agent, okay, to cause a disease. Okay, it's a property of a causative agent to cause a disease. That is called as the pathogenicity. It's a disease causing capability or capacity of anything. It may be the microorganism, it may be the radiation, okay, or it may be the, you can say, the other trauma. Fine. So that is called as the pathogenicity. Whereas the pathogenesis is a stepwise changes two things. What changes? Mechanical changes and chemical changes. Got it? Now there's one another term which may be you familiar, that is called as the pathogen. So pathogen is basically a collective name of all those microorganisms which causes the disease. Okay, so those kind of microorganisms is called as the pathogenic microorganism. Like, for example, pathogenic bacteria, okay, viruses, prions, protozoa, okay, then some of the fungi. So those all are called as the pathogen. Got it? No problem. Now there's one more thing called as pathologist. Okay, pathologist. Now a physician, okay, or a healthcare worker who studies the pathology, who have the knowledge about how to manage a disease, okay, how to tackle the emergency condition, okay, how to diagnose about a disease. Fine, they are those person, they are termed as a pathologist. They are termed as a pathologist. So pathologists are, you can say, specialized physician, okay. This physician can be a doctor, okay, or it can be a scientist. Fine, got it? No problem. Apart from that, there is one word called as the sign and symptoms. Okay, you know that first things you have to understand is whenever any disease occur, the first things which you have to understand is their etiology, their cause. Once you arrive at a proper etiology, a cause, then you have to understand their genesis, disease genesis, okay, their stepwise mechanical and chemical changes, and that is called as the pathogenesis. Fine. Now once you understand the pathogenesis, okay, you find out the cause, then you have to also understand that whenever cell undergoes mechanical or chemical changes, it exhibit certain, you can say, the manifestation, okay, and that is termed as a sign and symptom. That is termed as a sign and symptom. Sign and symptoms. Now just understand, symptoms is experienced by a patient, okay. So whatever things patient is going to tell a physician, these all things are called as the symptoms. Fine. But whatever you can say deviations or changes a physician is looking in the patient, that is called as the sign. So sign and symptoms are two different things. It's easy to understand, no? Symptoms is a manifestation of a disease, okay, which is experienced by a patient, okay, and this experience is also expressible to the physician, okay. And sign is a specific characteristics about a disease which is observed by a doctor or a nurse. Got it? So this is called as the sign and symptoms. Then once you understand the sign and symptoms, the cause, okay, the pathogenesis, then you have to understand about the management. So management is both by the both means, okay. It can be done through the drugs, okay, that is called as the pharmacological management, or it can also be you can say sometimes managed by the surgery. Fine. So management can be the pharmacological management. Pharmacological management means the disease is tackled through the drugs, okay, and the another management is called as through the surgeries. Then there are other aspects also like rehabilitation, giving the behavioral therapies, okay. So these all are called as the management. Once you given the management, then you have to understand, you have to study that these management, these pharmacological or the surgical management is they are working properly. So this checking process is called as the prognosis. This is called as the prognosis. Now let's just quickly revise what we studied. We studied that pathology is a branch of medical science, okay. It is a specialty of medical science which deals with study of the diseases, okay, their cause, that is called as the etiology, their stepwise changes, both mechanical and chemical changes, that is collectively called as, very good, pathogenesis, okay, fine. And apart from that, the management, okay, and prognosis. Management is how to cure the disease, okay, how to cure the disease, that is called as the management. It can be attained through both the means, pharmacological and non-pharmacological. In the pharmacological management, we are using the chemical compound, that is called as the drugs, and in the surgeries we are removing the parts, cutting the undesired parts, okay, the defective part. Mostly the surgeries are performed in the cancer. The first line of treatment, okay, first line of treatment in the cancer is the surgery, okay. Now then we also understand some of the other, you can say, the key terms. We understand that the pathogenicity is a property of a microorganism, okay. It's the capacity of a microorganism to cause a disease, okay. So it is a disease causing capacity or capability. Then we understand that whenever any disease occur, okay, it will show certain manifestation, okay, which is not a natural manifestation, okay, fine. And that is termed as a sign and symptoms. So sign is something which is observed by a physician, fine, and symptoms are experienced by a patient person, and these symptoms are expressible. These symptoms are expressible. Got it? No problem. Now let's move ahead, okay. Let's move ahead and discuss about the certain, you can say, the historical aspect, okay. So now let's move ahead and discuss about the historical aspect of the pathology. So before going in detail of understanding the, you can say, the history of the pathology, I'm just keep in your mind that the father of pathology, okay, who is known as the father of pathology? Yeah, it's called Rudolf Virchow. Rudolf Virchow, who did a very, you can say, the amazing experiment in the field of cytology. Okay, cytology is basically a study of the cell. Okay, it's a branch which specifically deals with studying the cell structure, morphology, their genetics. Fine, that is called as the cytology, and the name of the scientist is the Rudolf Virchow. Rudolf Virchow or Virchow. Okay, no problem. Now let's move ahead and discuss about the historical aspect of pathology.